The opinions on this program are solely their own and do not represent the views or opinions of Blind United. We strive to provide diverse perspectives and discussions on our platform, but the opinions expressed should be understood as personal viewpoints and not reflective of Blind United as an organization.
Let's get ready to rumble! Y'all ready for this?
Well, good Thursday morning, everyone, and welcome back to Coffee Time with Blind United. I am Ed, and I'm joined today with Brittany. Good morning, Britt.
Good morning. Sure happy it's Thursday.
That's right. And then my brother Pedro.
Good morning, everybody. Good morning. Happy Thursday.
All right. Well, so we do have another interest group today, being the fourth week of the month. So we have Let's Talk Spanish with Jesus Bautista. And that's going to be at 5:30 p.m. this evening. Great stuff if you're trying to learn some conversational Spanish. I mean, it's, not teaching traditional kind of whatever. He's just trying to make sure you can communicate with your neighbors and stuff like that. I mean, don't get me wrong. You're going to get the alphabet. You're going to get the vowels. You're going to get all of that kind of stuff. But it's really fun. It's a fun class, and he's really, really good at what he does. So if you're all interested in learning some Spanish, come on and hang out with us this evening at 5:30 p.m. Pacific time. And maybe you pick up a couple of phrases to help you out with your neighbors. So that's for the interest groups for today. So Pedro has an agenda for us today.
Ooh.
And he's got 3 different articles, basically all about AI in healthcare. So I'm going to pass this over to Pedro and let him run them in the order he wants to run them.
Yeah, well, they're the same, almost around the same subject, so it doesn't matter the order. But yeah, guys, let's listen to the first article.
UnitedHealthcare's prior authorization practices and AI integration, balancing cost and care. UnitedHealthcare, one of the largest health insurers in the U.S., has drawn significant attention for its rigorous prior authorization policies. These policies require patients and doctors to seek approval for certain medical procedures or treatments before they can be covered. While the company argues that these measures help control healthcare expenses and ensure treatments are medically necessary, critics claim that these strict guidelines often lead to delays and denials of crucial care. Recent reports indicate that denial rates for post-acute care services have surged under UnitedHealthcare's management. This increase has sparked frustration among healthcare providers and patients alike, who face administrative hurdles and time-consuming appeals. The insurer maintains that its policies are designed to prevent unnecessary treatments and to promote evidence-based practices. However, the balance between cost-effectiveness and timely patient care remains a contentious issue. In response to these challenges, UnitedHealthcare has been exploring the use of artificial intelligence, AI, to streamline the prior authorization process. The company is implementing AI-based solutions aimed at reducing administrative burdens and improving efficiency. For example, AI tools are being tested to review claims more swiftly and identify areas of inefficiency within the authorization pipeline. This shift to automated systems, however, raises concerns about fairness and transparency in healthcare decision-making. When automated tools are involved in reviewing claims or assessing medical necessity, there's a risk of oversights, leading to potential misjudgments in patient care. Critics warn that an over-reliance on AI algorithms could further complicate the appeals process, making it harder for patients to challenge initial denials of their claims. UnitedHealthcare acknowledges these concerns and states that it plans to continue refining its systems to ensure fair assessments and transparency. Despite these criticisms, UnitedHealthcare sees its AI-driven approach as a necessary evolution in managing healthcare expenses while maintaining quality care. The company believes that leveraging AI can help navigate the complexities of healthcare delivery, optimizing the prior authorization process to reduce unnecessary delays. Coffee Time Crew, let's dive into the world of AI in healthcare decision-making. Do you think automating these processes is a step forward, or does it risk patient care?
So, as I sit and think about it, I think on one hand, okay, the AI probably could help out as far as, processing the claims. And then the concern there where they're talking about, as far as people appealing, I think they need to take that out of AI and if you appeal, then it has a full review by humans, right? To straighten out anything that the AI may have missed. But I mean, again, healthcare costs are constantly going up and up and up. So if there's, a way to help out on that level, and then, like I said, if you throw the appeal being done, by a review panel, then I think we should be all right. I mean, that's my opinion anyway. So what you think, Brett?
I agree with you, Ed. I totally agree.
Okay. Well, Carol popped in. What you got to say about it, Carol? Maybe she can't get unmuted. Go for it, Pedro.
Yeah, well, yeah, it does sound good, and I agree with you. There should be a human panel to review. Uh, let's say if you do an appeal process, of course. But yes, having a AI put you in those two lines, in a straight line, I guess. Let's say someone could not fill out the form, or is mistaken on their answer or anything like that, or didn't understand a required question. How would you get a hold of somebody? Well, you probably could get a hold of somebody, but the AI is going to deny that claim.
Right.
Yeah, and then if it was a human worker, the human worker might be like, let me give him a call, let me make sure this is right, or let me see, you know what I mean?
No, I mean I follow all of that. I mean, but like you said, to me that's just maybe one of the uh, imperfect things or whatever you want to call it about using AI, right? Because now the AI is going to automatically, kind of reject the claim,
And
but then you got the right to review, and now it goes in front of a human. I mean, if they had a human doing the whole thing, then yeah, that probably wouldn't happen. But the reason they want to do it is to what? Try to cut that cost down. So
okay.
they're eliminating the human element within the actual claim process. And then, according to the article, it sound like they wanted to use AI for the review process right after the appeal. No, take it away from AI and let that fall on humans there.
Yes, yes, but let's say you get denied. Some people might be, oh, I just got denied, and might not even review. And if the AI provides, oh, look, one of your questions, I couldn't, I couldn't, it was incorrect or something, letting you know. But if it just says, oh, you've been denied your your um your medical, what you need, your procedure, and then you just be like, oh, okay. I've been denied. Some people just be like, "Oh, okay, I didn't got denied," and then they won't even do an appeal process.
Well, I mean, I agree. I mean, again, and we're talking about AI, so it's all about training it to do what you want to do. So,
Yeah, and how transparent it is too. Would it tell you that one of these questions it couldn't tell what was what was the correct answer or what you was trying to put in to contact somebody? If it does all that, I could see it. But sometimes with AI and stuff, they just be like, "Oh, you've been denied," or "No access," and there's no reason why after. You know what I mean?
right. You can change it up to where it's not denying your claim. It's just we cannot process your claim due to insufficient
Information.
information.
Hmm.
Please, review and provide the following information,
Yeah.
and then it would proceed, right? I mean, that
Yes.
makes sense.
Yeah, and that's up to the company as trying to be transparent. But if you are a company, you're all about the bottom line. You might not be so transparent like that. You just might send out, "You've been denied. We're sorry. Whoa, 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 whoa." You could, they're gonna put that message. You could file an appeal and all that, but people are gonna be like, "Oh, it's gonna take forever." But sometimes when it comes to this care, you need to follow that appeal process. Don't be ashamed that you got denied and then you think it's something just
No, I get it because,
put your
like I
process
said,
in. Hmm.
some of it's just normal health maintenance, and some of it's urgent care. You know what I'm saying? So,
Hmm.
I don't know that again, AI. Are you going to train it to recognize the difference between the two? All of that kind of stuff. So, I mean, there's a lot of questions, but again, knowing what little bit I know about AI, it's all about training the AI model to do what you want it to do. You
Yeah,
know.
yeah, but we're talking about companies that have this staff to build this AI model and run tests and do all that. They have that. It's not just a single person. So they wouldn't bring it out and didn't have it set up like how they want it. It just is it gonna provide the proper information when it comes to users that don't really use internet, don't really know how to interact with an AI and stuff? What about they just uh, a predetermined answer for each subject, just one determined answer. Let's say for each problem that happens, you know. And then what about you have a multiple choice? You don't have a place where let's say you wanna get help and you have to run through an AI again now to get to that person to help you. And you have to answer predetermined questions and stuff like that. What about your question about your application is not even in there? I ran into some stuff like that before. You know, and
Well,
I
I
said,
mean, again, and that's, I mean, from what I'm hearing, they're moving forward, but at the same time, they're trying to, work out
I hope so.
all those kind of little bugs and stuff. So, I mean, bottom line, let's keep it 100. It's coming, whether we will accept it right now or later. It's coming.
Yeah, yeah.
It's just a matter of them per se. Getting the system right, getting the AI trained right, to do what it's supposed to do the proper way. I
Yeah,
mean,
yeah.
everything that I heard you speaking of, I don't see why they wouldn't be able to train it to recognize those things. You
Yes.
follow what I'm saying?
Yeah.
So,
Yeah.
but
And also too, you know how they're saying it's gonna save money and stuff like that. Well, is saving that money is it gonna be passed down to the customer, us, to the people that is gonna get this
Probably not.
yeah, probably not. It's gonna stay the same for us, benefit them and their bottom line.
right. Well,
So just
I mean,
just to
again,
keep it a little
and
real, keeping it
no,
real,
I
right,
mean,
Brittany?
well, that's what we do right here. We keep it real about this stuff, at least in our opinion. You know what I'm saying? But again, like you said, they don't worry. They're more worried about the bottom line than our actual out of pocket costs. They worried about their shareholder more than they are about how much Now I gotta go get some other kind of food because I can't buy the food I normally buy because I can't, all that stuff. They don't take all those things into consideration. A lot of people suffer in a lot of other ways just to pay for their health care, and that's not right because again, if people ain't taking care of themselves right, they ain't eating right, whatever, they're gonna have poor health. Now they're gonna lean more on the health care, so it's
Yeah,
crazy.
yeah. With people rationing medication and things like that, you hear about elderly people uh, rationing their medication, and they shouldn't be doing that. They should be able to afford and have enough medication throughout the month. These medications do get expensive. I know they've been trying to control the prices on these medications. They've been having success in some of these diabetic medications like insulin, and I think there is more on the list that they're starting to knock down on the pricing,
Right,
because if you get the same medication here and you could go across a border and get it cheaper, or another country is getting it cheaper than us, and our government is getting it an expensive rate. It
right.
doesn't, it's basically price gouging.
Well, I mean, and here's the sad part about it is, I mean, don't get me wrong, I appreciate what Biden and Harris did with that bill, but uh, within the bill, you can only do so many medications a year. So they just did the insulin and some other stuff, and
Hmm.
now this year coming up, they got 10 more drugs. So they're trying to, work with the drugs that are more commonly prescribed,
Hmm.
and stuff like that. I believe, right? And then they'll knock them out. And then next year after that, they got 10 more, and it'll take a minute to get it down there. But eventually, we're gonna get drugs where they are affordable. Because I
Hmm.
mean, come on, once you done worked out the formula of the and patented and all that stuff, that's their whole thing. I mean, why not get in on the mix before uh, uh, they can start putting out a generic version of what you patented, right? I mean, if we can get the real stuff cheaper, the reason the generic meds are so popular is because it's the same medication, it's just cheaper.
Yeah,
I'd rather have the name brand if I could afford it.
yeah. And going back to the bill, on the bill that was proposed on the previous, it was all medications. But a certain political group had the House, so it came down to 10. and I think that's basically a slap to us in the public, a slap to the citizens, slap to the people that are struggling with their medication and stuff. We need this. We need it to, these companies are price gouging us. That's
Right,
what
right, right.
they're doing. Um, and in my opinion, there's all those medications should have been under review.
Well, not only that, you got to get into like the hospitals and stuff as well. I mean, like when they charge you, like 10, $15 for one Tylenol. Come on, man, that don't make no sense. You can cut costs in a lot of different ways in the healthcare system. Not only just the cost of actual medication, but again in the actual practices, within the hospitals and stuff. I mean, come on, man, why I got to spend over $1,000 a night or whatever it is to be in the hospital? You know what I'm saying?
Hmm.
I mean, it don't make no sense. It's not like I got a nurse sitting in my room all night long that's at my beck and call. That nurse has got, 5, 7, whatever patients that they have to deal with throughout the period of their shift, you know. So, but you charge me like I got my own personal nurse.
I know, and it's a group of nurses running around. There's one nurse on a station looking at five people. You know, and I know even an ambulance trip could cost you up to 20 grand, 15 grand, and you might not even use all the things they might have in there. But I think when just like for example, I don't know if you over here in LA we had a news story. A dude went to cover a pothole. It cost him what, less than $1,000 or $2,000, and he got a fine, all that or whatever because he did that. But they said ask the city to come fill in the hole. $50,000 to fill in a pothole.
Right.
$50,000, and this comes down to companies being like, "Well, it's the government. Let me charge them more for doing the same job that somebody that is worth less, but let me charge them a higher up price." And that that happens a lot in our government.
A lot of people don't know you can buy a blacktop in a bag just like you buy concrete. You know what I'm saying?
Mhm.
The only difference is you bust that bag of concrete or a blacktop out. You know what I'm saying? You just break it down, drop it down in the hole, smooth it out. You're good to go. I mean, yeah, of course, concrete you got to mix it and all that other kind of stuff. But the blacktop is just it's just in a bag. You rip the bag off, break it up. You know what I'm saying? It's got all the loose tar and stuff on it. You put it in the hole and smooth it out. We used to do it at our truck yard all the time, right? Because the trucks were always kicking up pieces of blacktop or the crack or whatever from the heavy trailers and all that stuff. Man, we go buy the blacktop in a bag and we just go around the parking lot and fill in the holes and drive back over the top of it. And it's smooth and good to go again. So I mean, again, there's a whole lot of things, a lot of government waste. Where they overpay for stuff. You know what I'm saying? These independent contractors. It's just there's a
Mhm.
whole lot of stuff that can be done. So I mean, I know we focusing on the cost of medicine and all that, but it just again that's just one area where they're working on where they need to be working on more than just that one area. That's for sure.
Yes,
So,
yes, and
so
I think the some of the hospitals has kind of been like, okay, most of these patients are gonna have some type of insurance, some type of a government assistance insurance, and they take advantage of that in the prices of one time. I know, like you said, $15 sometimes, and they know that the insurance is getting billed and the insurance is getting subsidized from the government, and and all this. So it's like, they just shoveling money at it without even trying to trim out the fat and save some money. You know what I mean?
but then you got other hospitals, like one of our hospitals out this way. My wife, she run in there, right, and she go in through emergency or whatever. All the radiology, the labs that do, check your blood. All of these things are now independent inside that hospital. So now you get a bill from the hospital for your stay, but then you get a bill from radiology for this, you get a bill from there, from that. And not all, you know what I'm saying? It's crazy. I mean, to the point to where when my wife passed away, Pedro, I'm serious. I had over $200,000 in medical bills because of that kind of stuff, and she had insurance.
Hmm.
She had insurance. It just depending on how the hospital operates. You know what I'm saying? So, uh, uh, you know, uh, uh, how about this? How about we get that single payer healthcare system? That way, we ain't got to worry about none of this old boo boo and stuff no more. Everybody's got health care. Everybody's paying whatever their premium is. I believe that should be, pretty much level across the board, right? And then boom, we move forward. I mean, even if it goes up a little bit as we get older, I'm still cool with that part. Just let's quit playing with all these 15 different this and 25 different that, whatever. It's, come on, everybody needs health care. Like they say, it should be a right to have health care, but I mean, come on, we're the only country in the world pretty much that charges for healthcare at this point. Everybody else has got free healthcare. That's why people are traveling to all these other countries when they got these illnesses. They
Yeah.
running over there to get treatment because it's free.
And it's
Yeah.
that's normal, guys. Getting free health care, around the world, and especially in the top 5, 6 countries, that's normal. The only unnormalness is us. We're the only one that allows, let's say, ads on TV. That's another subject there, but we're the only one that still we have to pay healthcare. And then if we had a single healthcare, they were doing the numbers after 5 years, it will start saving money.
Yeah. Once it starts balancing out, once everybody gets
Mhm.
signed up, I mean, again, a lot of reason people ain't signing up now because why? Depending on the insurance company you go to, you might have some sort of inflated, premium that you got to pay every month. You
Yes.
know, that's crazy.
And then you got grandmas and grandpas filing for bankruptcy due to medical debt, guys. Something that
Well,
those people work hard, work their entire life, and they just a health issue just came up out of nowhere. These are good people, and people are losing their homes out of medical debt, filing for bankruptcy. Um,
I mean, they losing everything they got. You know what I'm saying? I mean, it doesn't make sense. I mean, I think they just made it where now medical bills cannot go against your credit history because everybody's got medical bills.
yeah.
I mean, so now it ain't messing with your credit history no more. But I mean, again, I had to file bankruptcy. I mean, I had to start all over again. Credit took a dump, everything. But at least I was able to get that debt excused, and now I'm much better off than I was then. But still, I mean, why would I have? I shouldn't have to do that. You know what I'm saying?
Yeah, two
And that's
hundred
another thing
grand
that's
in a
sad.
row.
The sad part because I'm her husband, she's gone, and I'm responsible. I mean, come on. So no, it's crazy, but there's definitely some changes that need to be made within the healthcare system. I mean, I hope we get to a point where they do these cost cutting things that hopefully. I mean, I don't see us going to a single payer, not anytime soon, anyway. But at the same time, hopefully at some point with these cost cutting measures,
Hmm.
hopefully it'll, hit our side of it at some point rather than just pad the bottom line and for their shareholders. You know what I'm saying? I don't know. Maybe they shouldn't be allowed to go up to do stock like that. You know what I'm saying? Where they have stockholders, where they're looking for profits. Maybe all medical stuff should be nonprofit. I don't know. Maybe that might be another way to go, but I don't know. Just my thoughts. So,
Yeah, yeah, yeah. And George said, "Good morning to my Blind United family. Good morning, George." And we will be back after this break, guys.
If you'd like to know more about Blind United, you can visit our website at blindunited.org. You can email us at info@blindunited.org. You can call us at 909-846-8825. You can follow us on Instagram at Blind United Interest Groups. You can follow us on X at Blind United 22. You can watch our YouTube channel, Blind United. You could join our Facebook group, Blind United Interest Groups, or you can follow our Facebook page, Blind United. Did you know that people in third world countries do not have access to canes? The You Can Give initiative gives canes to people all over the world who cannot get canes. The You Can Give initiative not only goes to these countries and gives people canes, but they give people canes and a digital recorder that is solar powered that has instructions on how to use the cane and instructions on how to repair the cane. The You Cane Give initiative is a very worthy cause, giving canes to blind people all over the world. If you have a cane that you're no longer using, or a cane that's broken or bent, you can go to youcanegive.org and get a shipping label, and you can ship your cane to Jimmy in Tennessee, and he will refurbish it and give your cane to a blind person in a third world country. That website again is youcanegive.org.
They Jimmy and them, they just uploaded a bunch of videos to YouTube. I know we were talking yesterday. I mentioned they were. I seen the one where they gave a first cane to a young child that had a pink handle on it, and she was so excited. But I looked at some of the other videos. They had, bottom line, they went to a blind school and they gave canes away to a blind school. So it was all kids, and they had some of Jimmy's wife teaching people how to use, the kids how to use a cane. It was, kids using their canes and finding their way to their teacher for the first time, all that kind of stuff, man. So if you guys get a chance, go check out Jimmy on YouTube at You Cane Give initiative. A lot of great videos about the work he's doing. So that's why we support him everywhere we can. All right. Well, I guess I can throw it in there right quick and get it out the way as well. Another way you can participate in helping Jimmy out, he has another website where he does what we call, it's called customcane.com, custom with a K, and trust and believe it's your one-stop cane shop. You can get any kind of cane you want. You can get any kind of tip you want. You can get anything on your cane you want, as far as it doesn't have to be white with a red tip. It could be pink with purple polka dots if that's what you like. It doesn't matter. Any way you like it, he's got a cane for you. He's got all the accessories you can think of, from sheaths to Bluetooth speakers to the lights that you can put on your cane. You name it, he's got it. Customcane.com. All proceeds will go towards You Cane Give, so you can help that way as well. All right.
Yeah, custom with a K, guys.
Custom with a K.
Yeah. Let's jump into this other one.
The impact of utilization management on patients and doctors. A closer look at EviCore Healthcare. When major health insurers like Aetna or UnitedHealthcare seek to reduce healthcare costs, they often collaborate with EviCore Healthcare, a company specializing in utilization management. The premise behind EviCore's work is straightforward. Manage and review healthcare claims based on evidence-based guidelines to ensure that treatments are deemed necessary and cost-effective. However, this model presents a series of challenges for both doctors and patients. From the perspective of doctors, EviCore's role in managing prior authorizations creates a significant administrative burden. When a physician recommends a treatment, procedure, or test for their patient, they are often required to seek approval from EviCore before it can be covered. This involves submitting detailed documentation to demonstrate the necessity of the proposed care. Despite using automated systems like IntelliPath to expedite the process, doctors frequently find themselves caught in repeated cycles of appeals and paperwork, taking away precious time from patient care. For many healthcare providers, these additional hurdles can feel like questioning their professional judgment, which can be frustrating and demoralizing. For patients, the experience with EviCore can be equally, if not more, distressing. Imagine dealing with a health condition only to have a recommended test or treatment delayed or denied by a third-party reviewer. EviCore's reliance on clinical data and standardized guidelines may prevent unnecessary or redundant treatments, but it also leads to instances where necessary care is denied. Patients must then navigate a complicated appeals process or participate in peer-to-peer consultations where doctors argue on their behalf. These roadblocks can exacerbate the stress and anxiety already present in managing serious health issues, leaving patients feeling powerless in their own healthcare journey. EviCore's involvement spans multiple specialties, including radiology, oncology, musculoskeletal therapies, and cardiovascular care. While the company aims to ensure cost-effective treatment, the reliance on automated systems can lead to delays if documentation is deemed incomplete or inadequate. Even though avenues for appeals and consultations exist, the initial denial of a claim adds layers of complexity and tension to an already challenging situation. Ultimately, the utilization management model used by EviCore highlights the struggle between cost containment and patient care. Doctors and patients alike are often left navigating a system that places administrative obstacles between a diagnosis and necessary treatment. While these cost control measures aim to prevent unnecessary spending, the resulting delays and denials can disrupt the doctor-patient relationship and impact the well-being of those seeking timely medical care. That's our take on the growing complexity of utilization management. Coffee Time crew, let's hear your thoughts and experiences on navigating these challenges.
Uh, I mean, again, that's some of the same elements we were talking about in the other one. You know what I'm saying? It's you got this automated system that's running through this checklist of whatever stuff, and then you know you either get approved or you get denied, and then like I said, I agree with the doctors. I mean, the doctors you would think would know best. You know, whatever the doctor is suggesting that you do. I mean, I can see where they would get frustrated being questioned, right? So, I mean, to me, it's the same old thing. I mean, these doctors shouldn't have to defend their reasoning for wanting to do certain things to a patient, you know. But then again, people think I'm crazy. When I meet a new doctor, I always ask them, okay, are you in to help, improve the quality of my life, or are you in it for a paycheck? Because if you're in it for a paycheck, I don't want you working on me. I'd rather have somebody that's more into it for the quality of life for people, help improve that. But, uh, you know, not all doctors are doing that. I mean, the money's going to come with it. I don't know a doctor that don't make good money. So, I mean, what's your motivation? Trying to help people or trying to get paid? And, but again, this process, I mean, I don't know. There's got to be something short of doing a single payer. I don't know what's really going to fix it all.
Yeah. Yeah, doctors do make good money, but there is other people making way more money in the insurance and stuff side of it, the administration side of it. Yes, doctors do make good money, but the cost after their education is big. It's big, and then having that idea from companies that from, let's say, insurances, knowing that these doctors are coming to to save lives. It's not about the money for them, so they could kind of let me pay them no more, little bit, like let me pay them at least the baseline. You know what I mean? I've been
Uh,
hearing about some of these doctors being in debt for years because of their medical stuff, and they do pay and all that, but and they end up living a good life. But if they're here for saving lives, they should be appreciated by the funds too. You know what I mean?
right, I agree. I agree. And again, that's why I'm saying the money's going to come with it. But if it's your motivation, then you're getting into the job for the wrong reason, in my opinion. You know, but
Yes, yes, because you could be in
and
it
then
for the
there's
money. Uh huh.
and then there's other ways. I mean, I've heard proposals where, as an example, they go and they spend all this money. I get this lot of money, to go to medical school and all this stuff. And then if you get into where you specialize in a certain aspect of it, right?
Hmm.
A lot of money there for the education. But as they say, now if you go to work in a local county hospital or something like that, you work there for a few years, at a base salary, then all of that debt gets dismissed, and now you can go get a job at Cedar Sinai or whatever, one of the private hospitals. After you've done your term, you're within the public healthcare system. Does that
Yeah,
make sense?
yeah, that could be an answer you put in. basically doctor community service, and you could get some dead knocked off. You know,
Exactly. I mean,
that'd be pretty dope.
whether it's the medical, I mean, even the lawyers and stuff, rather than go straight to work for some big law firm. I mean, if they're gonna pay your debt, then go for it. But if you're sitting there struggling and you want to have your own practice, whatever, then maybe you get into doing, uh, a public law. You know what I'm saying? Where you're a public defender or DA or something like that, where you're working, for the people for a certain amount of years before you go work for one of the big firms. I mean, I see that working across the board. You know,
It's
so
implementing it. Yeah, it does sound good, but implementing it, I know you have to do community work as a doctor before you even start getting a residency. I guess it's like volunteering and stuff like that. Even I
well, I
think.
mean, even your big time lawyers, they're required to put in a certain number of pro bono hours a year. Pro bono, that means basically you're working for free, right?
Mhm, mhm, mhm,
That's how a lot of these, not all of them, but a lot of these special counsels, like for instance, remember that thing that just jumped off with what's her name, Fonnie Willis down in Georgia.
mhm,
I mean, she was having an affair with that dude, the one attorney. But bottom line, again, he came in doing it as a pro bono, and then she just hired him as a special attorney.
mhm.
They, I mean, maybe that wasn't a good example because he was actually inflating all of his costs. but, but I mean, I do know that there's a lot of people have gotten out of prison and stuff like that due to good attorneys doing pro bono work. You know what I'm saying? Let me go in there and put in this pro bono time. Oh, this case right here. Oh, yeah, he had a public defender. Oh, yeah, we can fix this. And, get these folks out of jail, time served, whatever. You know what I'm saying? And just because of a public defender, I mean, how you, to me, public defenders, they work with the DA. They go sit down, they have lunch. Okay, this is what we got on the docket. They have breakfast or whatever. This is what
Mhm,
we got on the docket for the day. How you want to deal with this one? Okay,
mhm.
that was done. Now how you want to deal with that one? And then it's just running people through the system. You don't really have an opportunity to say nothing. You can't fight nothing. They tell you, okay, well, you can fight it, but if you lose, they're not gonna give or you can take this deal. But I didn't do it. Okay, well, you just know if we don't win, you're gonna do 30 years,
Yeah, yeah, it's a shame because you're right. The public defenders do go sit with the district attorneys and the like, the other side, the prosecution side, and sometimes they make a decision before it even gets to the judge, before they even see you.
Right, right,
They
right.
already have made a decision, talked about it, and see how they're gonna go about the case.
Right, 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 right.
I know for a fact, in a case that the girlfriend was in the elevator with the prosecutor and the public defender, and they were discussing the case on how they're gonna proceed and this and that. Already trying to cut a deal while they were all going to lunch and sit together.
Oh yeah, yeah, yeah. I mean, and again, I mean, I know we turned it into law, but it still goes the same way with the medical thing. I mean, you know, so they get denied here because of whatever. Man, these people pull their little money together and they'll run to Mexico or whatever, or somewhere else and get the procedure done because they don't have to go through all that hassle. If they got enough money to get to one of the countries that have free health care, then they go over there and get it done. I mean, look at what that's why I like old boy. What's his name? Bernie Sanders.
Mm-hmm.
I don't know if you remember a while back, a couple of years back, man. He loaded up a bunch of people and took them down to Cuba because Cuba's got free. He's a communist country, has free health care. Let's go down there, and they went down there. A bunch of, I think it had something to do with diabetes and insulin. I know he took a bunch load of people up into Canada, all of that stuff. Where they got the single payer thing going on, right? Or just government provided, just to get
Yeah.
stuff that they couldn't get here. It's supposed to be the greatest country in the world, the richest country on the planet. You
Mm-hmm.
know, I
And
guess
they
that's
tell
why
you,
we're richest because we charge for every damn thing.
yeah, well, the thing is too, they always tell you that's a socialist. That's a socialist talking point. That healthcare. When do you see a socialist country make it? But it's not that. The thing is, the normacy now is to have healthcare for free. The top 6, 7 countries have healthcare for free.
Right,
Why
right.
are we the only one? So that makes us the outsider. That makes us not the norm. And the
Right, and
norm
we're
is
definitely not
having,
the only capitalistic society. There's a lot of capitalist
yeah.
society out there, but we're the only one that still charge for healthcare. I mean, there's got to be a certain level of social safety nets, right? And I'm healthcare is one of them. You know, healthcare, education. I believe those are things we definitely got to have. Some like our Social Security system. I mean, they need to quit messing with that. Leave that alone. That's for the people that don't have those big 401ks and
Hmm.
profit sharing. They didn't get it. They Not everybody can climb the corporate ladder. There just ain't enough room up on top. So
Plus,
uh,
the people that their pensions got depleted in 2008 and other things like that, even in
right,
the
right,
early 2000s when the internet boom busted. Remember that? So people
all of
lose
that.
their pensions. Some of these companies do not manage their investment correctly, and then the people that are going to retire is the people that end up losing and not having nothing, and having that
Right, because
social net, it's a lifesaver, especially
but
when it first
but
came
the
out. Hmm.
but the people that are managing those investments, right? They get paid regardless.
Yes, they
That's
do.
why they're not doing their due diligence to make sure that the money is being invested properly because it doesn't really matter to them because they're going to get paid either way.
And and
So
and the Social Security program is a very popular program. You people don't like to really say it, but if you're pointing to healthcare being a socialist program by having healthcare for all. But look, Social Security, we all receive it. It's a really popular program. It's a norm. Some things just need to be like that. Some things just need to
well,
be like
again, the
that.
only people that are is not popular with are the people that have climbed that corporate ladder, and they're making so much money that they're never going to need to use Social Security, so
And
therefore they're against it. You know what I'm
they
saying?
should be
But
happy they don't need it.
well, I mean, yeah, they're not realizing the blessings they have by being able to make, $2, $3 million a year, 20, 30, 50, $100 million a year, whatever the case may be. But, that's not everybody. Not everybody gets that. I mean, man, again, even if they just took and right now, what is it, 125,000 is what they tax on Social Security for folks that make above that, man, I'm saying, man, take that up. Number one, I say it's only fair they pay for all, whatever they make. But I mean, if you just boost that ceiling to, $1 million, do you realize how much money you would put into the Social Security system by that? If
Hmm.
they taxed them on the first $1 million, we wouldn't be worried about people on Social Security living right on the edge of poverty. In most cases, they're living in poverty. So again,
Micromanaging all the expenses,
all of
micromanaging
that. I
everything.
mean, we go back to what we were saying earlier. People, cutting their pills in half, or maybe they're eating cat food, dog food, whatever, because they had to pay for their medicine, all this other kind of stuff. It's crazy in America that we got this kind of stuff going on, but it happens every day. It happens
And
every day.
and I got one more article for us, guys. Let's take a listen.
CVS Health's data-driven transformation, personalizing healthcare with AI. CVS Health is redefining the future of healthcare by integrating advanced data analytics and artificial intelligence, AI, into its core services. This strategic move aims to create a more personalized and efficient healthcare experience for its customers, while also reducing overall costs. One of CVS's flagship initiatives, the Transform Diabetes Care Program, utilizes machine learning to predict individual risk levels and guide members through tailored preventive care plans. By analyzing patient data, this program can provide personalized health interventions, helping individuals manage their diabetes more effectively and prevent costly complications. This proactive approach not only improves patient outcomes, but also alleviates the financial burden on the healthcare system. Similarly, CVS's Transform Oncology Care Program leverages AI to connect cancer patients with relevant clinical trials based on their genomic data. This targeted approach allows for more precise treatment options, offering patients access to cutting-edge therapies while reducing unnecessary expenses. By employing AI-driven recommendations, CVS enhances the effectiveness of its oncology care, improving patient experiences and treatment success rates. To support these initiatives, CVS Health has partnered with cloud platforms like Microsoft Azure, enabling the company to scale its data-driven efforts seamlessly. This integration helps CVS enhance medication adherence by personalizing communications and reminders for patients. For example, AI-powered algorithms identify when a patient is likely to miss a dose and send timely reminders, improving medication compliance and overall health outcomes. By combining these innovative technologies across its pharmacy services, health clinics, and insurance offerings under Aetna, CVS is creating a holistic, streamlined healthcare ecosystem. This transformation aims to deliver seamless customer experiences while lowering costs and improving overall health outcomes. Okay, coffee time crew, let's discuss the future of personalized healthcare. How do you feel about AI playing a bigger role in health management?
Uh, Again, in certain aspects of it, I agree. If AI can help, cool. But at the same time, man, I hate dealing with these automated systems. Sometimes they're AI, sometimes it's just, I mean, again, there's a lot more waste right there. Like example with mine, I get a phone call from an automated system and wants me to confirm my appointment, right? For whatever date. And then as soon as I confirm, I get another phone call just to say thank you for confirming your appointment. That don't make no damn sense. It don't make any sense. I mean, that's money you just wasted right there. I don't need. I know I confirmed it. I don't need you to thank me for that. I don't. At least I don't need you to notify me and tell me thank you. I mean, it's just there's a lot of waste in it, and if AI can help, yeah, but we don't want to get, especially when we're talking about healthcare, we don't want to get too far away from human interaction because AI has no compassion. I guess that's the best way to put it. They don't see, they don't think the way humans do. Okay, well, now let me go ahead and approve this one because this person really needs to get this care. I mean, you just got to believe that when they're training these AI models, they're not training them per se for our best care. They're training them to streamline and maximize their bottom line. That's just my opinion anyway.
Yeah,
So
yeah. Well, CVS is trying to do this to save money in the healthcare. That's what they say, but they're saving money within their store. And I could see that having AI reminders is basically what they're kind of saying. To make sure to follow up for you to take your medication. That could work for people that might forget, and people that might have Alzheimer's and stuff like that. That they get a message, it's time to take your medication. Make sure you take your medication this week. That could be really helpful and stuff, and maybe cut back on wasteful is what their CVS is calling it. But think about it. If they know you might skip a week or two on your medication, they might not give you a week that week or that second week medication. And then when you want to take it, you might not even have it. So who knows how it's gonna go? And I hope that we are able to find a balance, a good balance that will benefit, especially the patients, and just talking about all the stories across the whole board, that will benefit the doctors too. The doctors are here giving us health care, providing their opinion and letting us know what we need, and then to put a barrier in front of them, another barrier in front of them, and then in front of us, the patient, it could get daunting. It could get daunting going against, like, trying to get your case heard or trying to get things approved with the massive medical care complex that we have. Just navigating that maze of the healthcare gets a little tricky sometimes. And sometimes when your healthcare is too much and you've been paying a healthcare insurance provider and then they drop you because they're saying, your healthcare is becoming too expensive. Now go find another healthcare insurance provider. And it gets daunting. It's like a big old maze that you have to navigate. And putting a little more barriers on the doctors too. The doctors are like, oh man, I have to go, file an appeal. I have to write this and write all this out for my patients. And, you know, you
I
just
mean,
make
that's a
it
big
hard
pain in the
headache.
butt. That is definitely a big pain in the butt that the doctors should not have to deal with. Let them folks just concentrate on performing the health care. Don't make them have to defend, a surgery. You know what I'm saying? Well, this is why I need to operate versus doing it, intravenously or whatever. Don't make them have to do that. I mean, they're making the best decision for the patient, and we got to find a way to streamline that for them so they don't have to defend that and all that kind of good stuff. So anyway, I don't know, Britt. We got any more comments before we get out of here, sweetie?
We
George,
sure do. Monica said good morning and happy Thursday. If you're thirsty, go get a drink. And Monica's going to have an iced tea today. So great,
Okay.
Monica. That sounds awesome.
Well, don't
And we
forget
were
it.
supposed to hang out with Monica. What had happened?
I got other stuff going on at the house. I can't go.
I can't.
It
I'm
doesn't
not going
matter. No
either,
problem.
Brett. I'm not going
Well,
either. Meetings
it's
and
all
stuff like
good. It's all good. Well, I guess that's it.
And what you think,
Well,
Brittany, about these AIs in the medical field?
I mean, AI is here to stay. We better get ready. There ain't nothing we could do about it. They've been implementing it for years, and we're just now hearing about it, really.
Yeah, now it's in
And
the
I mean,
forefront.
there should be human oversight, but I know that at the end of the day, it's about saving money. If it don't make dollars, it don't make sense.
we have to rephrase that. I mean, yeah, they're cutting costs as far as what it costs them to do healthcare, but it ain't saving us no money at this point because whatever money they save is going to turn around and end up going to their stockholders. That's one of the bigger issues. I mean, money greed is it's going to be the downfall. It really is because we've talked about that before. That's another addiction. Money. You get super greedy, and then you don't care who you hurt. You don't care about nothing. All you care about is making more and more money. And I mean, I'm sorry. It shouldn't be, especially when it comes to healthcare. That should not be. Shouldn't have anything to do with it. You know what I'm saying? I mean, that's just my opinion.
Healthcare is a right, not a privilege.
I agree. It should be. There definitely should be a. It
Yeah,
should
well,
be
we're not.
definitely be a.
Yeah, when the normacy is gone from our idea of paying for this healthcare and not having it as a right, like other people in other um, powerful countries that they say the top six, we're not the normal ones. We're actually the outsider and the weird thinkers, like the weirds. because it's normal for now to have healthcare covered in the top 6 countries. And we're the only one,
Right,
So
right,
that
right,
makes
right.
us the sore thumb. You know what I mean?
I hear you. I hear you. Well, as usual, I mean, we talk about issues that are going on within our lives and within our country and stuff like that. It's we just bring this information to you and trying to share it and give our opinions on it. So we hope you truly do appreciate that. If you're listening to us on Facebook, I really appreciate it. If you subscribe, like and share and follow, all that good stuff. If you're over there on YouTube, please like, subscribe, share, hit that notification bell, all of that. It all helps Blind United grow and be able to do more of what we do on a regular basis. So again, I hope everybody enjoyed what we had going on today. I hope you enjoyed the conversation. We will see you back again tomorrow for TGIF. Same Blind United time, same Blind United channel, right? So everybody enjoy the rest of your day, and we will talk to everyone on the next one. Have a great day.